Hey, this is Dr. Conley. So, November is Digestive Health Month here at the Center for Healing Arts. And Kristen, my wingman, is sitting here in the background, so she will be here. I may go to her. Um, I want to put more things on our website, on our YouTube page, rather. So, we're going to start with digestive problems today and add it to the YouTube page. So, it's more of a presentation than a workshop right now. But I wanted to talk about digestive health because it is one of my things that I do feel very compelled to talk about. Today, we're going to focus on the big three in digestive health, which is acid reflux, IBS, and celiac disease. There are symptoms and conditions. Now, remember, in these workshops are called body signals, and body signals are symptoms and it's your body's way of communicating to you. So what are body signals? Body signals, your body's way of asking for help. Ready? Are you listening? Right? Here's what we know. Sleep issues are a symptom. Believe it or not, if you can't get restful sleep, they're a symptom. General sleep problems, sleep apnea, restless leg syndrome, they're all symptoms. And again, what are symptoms? They're communications from your body. Your body's trying to tell you something's wrong. So what's your body trying to tell you, right? Is your body telling you that there's a problem? Are there things breaking down where there's a stress where your body cannot adapt to that stress? And then tissue breaking down. Are you moving away from health or are you in trouble? And you need to address it. You need to make the changes that are related to it. Let me ask you a question. Ready? Is that a smart system or what? One of the things in our workshop, Better Results Faster workshop, is we ask, is the body smart or stupid? Well, you know what? We know the body's smart. And we know that your body's trying to tell you something with these body signals. So we refer to them as body signals. So how you interpret and respond to what your body's signaling is what makes all the difference, i.e. a headache, take a pill versus figure out why you're getting the headache. We know it's nerve pressure. Do you listen to the symptoms or do you make changes and stop damaging your body and start healing your body, or do you try and ignore them, press on? One of the things, we had a poster in the office many years ago, maybe it'll go away. The 5 most important words, right? Maybe it'll go away. No. Or just it's part of aging and it's what's going to happen as I get older. Not true. And the thing is, when we look at this, could it be worse? Do you try to stifle the symptoms with drugs, medications? We're putting ourselves to sleep with a drug. We're waking up in the morning with a drug. Dangerous chemicals that only suppress your body's communications. So that what? You're sleeping better temporarily, and then your symptoms get worse because you're ignoring it. Is that smart or stupid? Think about that for a second. So who's ready to learn a better way? Symptoms or body signals are only the tip of the iceberg. So there's your slide. And the way that you think about symptoms drives your choices, which also drives your outcome. This is critical because if you're only worrying about treating the tip of the iceberg, you're really ignoring the underlying cause, and then it allows it to become bigger and bigger. So let's talk about that. What do symptoms really say about your health? This is called the health continuum. And everyone in this room, if you're listening in this room, right, is somewhere on this health continuum. And it's part of what I try and teach with patients. You do a rehab program with us, you're working on your spine, you graduate from rehab, and then what? You stop? No. Health is dynamic. Where you can't get there, and then it's not a destination, by the way. It's a state. It's a continued state. Okay. So when you're on there, when you're left of center, you'll have symptoms, right? And symptoms are end of the problem. So what direction are you headed in? Towards health or away from it? We're all moving at different speeds, okay? So our first job is to stop the negative momentum going in the wrong direction and get patients going in the right direction. And again, understanding the body signals, the alarms of the body, learning, it's funny, in what we talk about with body signals, learning how to speak body is really what your body's innate intelligence does. Learning how to interpret the body signals so that you can make better decisions leads to better outcomes and better choices. So what's your objective? Symptomatic relief or regain health and function? This is the choice that we often sit and talk to patients about when they're choosing what they want to do to us. Do you want to get a few adjustments to get pain relief, or do you really want to work on the body as a whole? This takes us back to the 3 causes of health crisis that we talk about in our workshop. And the number 2 problem is people are taught that symptoms are the best indicator of health. Really now. So let's talk about that. Feeling versus function. There's 3 parts of the central nervous system, okay? Motor nerve, sensory nerve, and autonomic nerves. What science tells us about symptoms is less than 10% of nerves feel pain. It's actually much less, which means that the most common thing that's happening with these symptoms is the most common symptom of a subluxation is no symptom at all. Right? Subluxation is the bone out of place causing pressure on the nerve. It's the premise in chiropractic. This is true for most common health issues, by the way. For example, what are the common symptoms of heart disease? Okay. Now, it's not a heart disease workshop, but in women, by the way, heartburn is a precursor of heart disease. But yet most people don't think that. Right? What are the common symptoms of diabetes? I have patients that tell me, well, my doctor says I'm not diabetic because I don't have this number on my lab, but yet they're just on that border for many years. So are they changing their lifestyle there, or are they waiting till they're defined? No, it's the same thing with cancer. Do you eat healthy and work on anti-causing cancer, anti-free radical supplements? They're not glamorous, by the way. Instead, we look for a lump. At that point, cancer's already going on, and that's the problem. So even in the most ubiquitous, like tooth decay is another common situation. When you see a cavity, it's too late, okay? So by the time you have symptoms, most dental issues are already gone. So is an early sign or late sign something from the standpoint of the problem or the symptoms? So why are we taught to judge our health and manage our health by symptoms? Think about that for a second. Just blew it out of the water. So being healthy isn't wait till you have something to become and react to it. It's being healthy, and there's rules for that. Dangerous belief. I'll just take the pill, right? Drugs. Listen to the world. Look at the world we live in right now. And I ain't going there on COVID, but it's a subject where do drugs work? Well, remember, gas pains, indigestion, constipation are not the problem when we talk about digestive health, right? How can I take a drug to get rid of the gas? Okay. And that's what happens. We take care of things to take care of the acid in our stomach, take care of the constipation in our colon. Drugs do not, oops, I'm flying all over the place. Drugs do not correct the problem. They mask the symptom of the problem. And you still have the problem, and the problem gets worse until the drugs don't work. Okay. It's the most ridiculous thing. Then stronger, more dangerous drugs, and then obviously more side effects. So there you have it. I laugh when we talk about this because of the people that they use for ads. I think this is for the purple pill. And again, hands up if this type of drug is insulting your intelligence. It's just dramatic. So read the list. Side effects: headaches, abdominal pain, irregular heartbeat, persistent muscle spasms, seizures, diarrhea, abdominal or stomach pain, cramping, fever, blood, mucus in your stool, rash, itchy, swelling, especially in the face, tongue, and throat, severe dizziness, trouble breathing. Those are all the side effects of what that guy's holding up there. Who would want that? It just drives me nuts. It drives me nuts. So dangerous belief, your problems will just go away if you ignore them. Yep, we talked about that. Have you ever tried to ignore your way out of a problem? Nope. Do problems get worse, or do they get worse? Duh. So the 5 most dangerous words in healthcare, maybe you'll go away. Okay. Again, hands up if you know you have to take action to get better results. And before you can take action, you want to try and solve a problem, you must first understand the problem. So let's take a hard look at the cause of most of the stomach problems that people struggle with today. And so stress. And the interesting part about stress is we go over this in almost every one of our workshops. Stress comes from thoughts, toxins, and traumas. Obviously, the trauma is obvious. Toxins a little bit more, that we can understand, but thoughts really end up being something that we raise our eyebrows to. So again, let me read the slide for you. Who here agrees that modern life is unnaturally stressful? Raise your hand if you think modern life is unnaturally stressful. Keep your hand up if you think life is getting more stressful every year. Stress comes to us from every angle: physical, chemical, emotional. These are known as the 3 T's: thoughts, toxins, traumas. These stresses cause a condition called subluxation. So this is what we talk about time and time again, and it's what we get. It's what we find that we're redundant with in trying to communicate why subluxations affect everything that we're talking about. Better premise: healthy is normal, your body's smart, the nervous system is the master system, your spine is your suit of armor, and modern life is unnaturally stressful. I can go on about 1, 2, 3, 4 all night long. Okay, being healthy is normal. That is the normal thing. And when we have a symptom or a body signal, it's your body's way of being smart to let you know. How you respond to that is part of the signal and what you want to do with it. And the nervous system controls all this. And guess what? Your spine protects it. So we'll get into it. Stress, adaptive physiology, blood pressure, heart rate, muscle tone, cholesterol up, caused by stress hormones, by the way, and wound repair, believe it or not, clotting factors, fear and anxiety. You can see a medication for every one of these on TV. Insulin sensitivity downregulated, blood sugar up, immune response downregulated, sex drive downregulated, decreased serotonin, sleep cycles interrupted. Last month in October, we did sleep in the office. So ready? Here's the last one. Digestion slows and stops. That's what we're talking about this month. Stay tuned for all the other workshops that correlate with all the other scenarios. So adaptive physiology and how it is affecting your body. Okay, so this is about what we're talking about when you have an acute stressor and, believe it or not, a chronic stressor over time. And our digestion slows down with all these things that are happening. And that ends up being what? Constipation, irritable bowel. So the autonomic nervous system is part of the nervous system. And it's an interesting way when you think about autonomic. I learned it when I was in chiro school, more along the lines of automatic, right? And there's 2 types of responses in the autonomic nervous system. So when we get into this, the nervous system breaks down into parts. The autonomic part is the part that runs all the organs. It's the unconscious control of your body. And there are 2 parts of that unconscious control: the parasympathetic and the sympathetic. What's interesting is sympathetic is considered fight or flight. It's when you see people do dramatic feats of strength. I always remember my mother in the sympathetic scenario, because as a kid, I was 5 years old. I was pretending I was an airplane, and I was running around in circles in the yard, and my mother was cutting the grass on our riding mower. Now, it was a little Springfield riding mower. It had a 22-inch deck, so it was a little riding mower. But my mom was 4'11". She was coming down the side of a bank, and she had already told me to stop doing it. And of course, I wasn't listening. And I slid and I fell in front of the lawnmower. My mother was coming at me with the lawnmower, and I slid, and I was on the embankment and I couldn't get up. I can tell you what the bottom of a lawnmower looks like, because my mother, 5 foot tall, put her legs out, probably farther than she could reach, grabbed the steering wheel, and pulled the lawnmower up into the air. I saw the bottom of the blades right in front of my face. My mom held the lawnmower up long enough, and I crawled out from underneath. That was a moment of fight or flight. My mom had this dramatic strength, right? Well, that's like the stuff we hear about and see about, right? So I got an example of it in my life. But the other ones are the parasympathetics, the ability for our body to rest, repair, guess what? Digest, and guess what? Reproduce. Those are all the things that happen on the other side of the nervous system that has a tone to it. And guess what impedes that? Subluxations. So nerve supply is very important, even for the basis of digestive health. So when we look at it, nerve supply, life supply, flow of the intelligence that keeps your body healthy and healing. And again, your spine is the suit of armor. Subluxations. caused by joint misalignment, watch how this gets worse as we go along. Soft tissue damage, inflammation, nerve irritation, muscle spasm, guarding, blocking, loss of inhibition. Now we're doing decompression here in the office now. Decompression is the distractive technique to work on disc injury, as you can see the herniated disc in the picture, and lost inhibition. The disc has a poor blood supply. Motion actually saturates the disc, and the motion is needed for the disc to actually hydrate. So when you imbibe fluids, you imbibe means you hydrate your body. When the subluxation becomes so tight that there's muscle spasm and joint fixation, the disc actually starts to wear down. Well, guess what also happens during this? Elevated stress hormones are also a symptom as a result of it. Causes of subluxation, bad habits plus all the others, add them together, therein lies the issue. So macro, it's like, doc, wait a minute, we're talking about digestion here, right? Well, we'll get there, okay? We're talking about my bowel habits. Yep, we're gonna get there, because low back pain, okay? All the nerves that go to the muscles in your low back, guess where they go? Your colon, all right? And we're gonna get there, okay? So macro trauma, big things, car accidents, slips and falls. Commonly micro trauma, small things that add up, sitting improperly, using a computer, sitting too much, spending too much time looking at a screen, tech neck, which, you know, we talk about tech neck. Back in the early 90s, when I tried to communicate that to a patient, the MD told the patient that they didn't need a referral to see me because tech neck was crap. Yeah, go figure. So not true. Chronic constipation. Let's look at our first symptom, right? Chronic constipation. Like all these, there is a continuum. Some people notice it's more on and off in the beginning. Others struggle with it. And then what? We call this the new normal, what we're willing to accept. And I'm going to tell you, that's anything but normal. Constipation is a serious issue. And it's funny, an engine is only as good as its exhaust system. And it really is interesting, because what's the exhaust in the engine? It's the byproduct, right? So vapor, water from the combustion, all that comes out the exhaust. Put something in the exhaust and block it, and tell me how the engine runs. It doesn't work right? So when we talk about the root cause of constipation, it's a body signal. So as we said, stress can often be the root of a cause of a symptom in this type of a stomach issue, right? Often there's more to the picture than emotional, psychological stress. Let's talk about the stress on the nervous system that controls digestive function now. Let's get there. Chronic constipation. Ready? First three vertebrae in the neck. First two lumbar vertebrae, L1 and L2, which is just below the bra line. And then the L5, S3 nerves, which is along your back pockets and your hips. So this is related to chronic constipation. So when we talk about it, L5 to S3 controls bowel tone and motility. L1 to L2, spastic blockages. And then upper cervical is the vagus nerve, and the vagus nerve controls everything below the diaphragm, okay? Irritable bowel syndrome, Crohn's disease, celiac. These are all byproducts of what they eventually label the things that are involved. So when we talk about irritable bowel, IBS, irritable bowel is inflammation to the bowels, which is the lower part of the large intestine going into the sigmoid colon. Crohn's disease is inflammation and the loss of motility from the small intestine into the upper part of the large intestine. And from the small intestine to the large intestine, there's something called the celium. This is where celiac ends up being inflamed. It's right after the stomach and the small intestine, and where the small intestine becomes large intestine. So discuss the anatomy and the function of the gut. Okay, ready? You are not what you eat, you are what you absorb. So when we look at this, the gut wall is a barrier from the inside, okay, which is basically the bloodstream, to the outside of your body. It's where absorption happens. Tight junctions and permeability are what you're looking at in the picture. The gut wall is a bunch of little villi, just like in the lungs, we know about the little villi that basically absorb. But when the point is, when the way that you're looking is actually to increase absorption, okay? Absorption of nutrients in the small intestine, and then the large intestine, absorption of fluids that need to be out of the body, basically removing toxins. Okay. This is directly related to your immune response. Okay. Now, grains, things that end up creating the problem. They're acidic, low nutrient density, omega-6 fatty acids, which are the bad ones, high glycemic index, which spikes our blood sugar, toxic irritant properties, these phytates, which are anti-nutrients, lectins, which are in gluten, wheat, rye, but so look at our lifestyle, right? And we've been, when people ask me about what diet, I typically will tell them the standard American diet is what ends up being the problem. And from that standpoint, there's a lot of issues that go along with it. Okay. So reading through that, there are your issues. Leaky gut is when you see the fact that it becomes inflamed in the openings and medications irritate this. It needs to be swollen and profitable and connected. This basically, you can see it, normal tight junctions on the one side versus the inflammation on the other side. And what happens with everything, where did it go? Wait a second, I got to back up. There we go. So yeah, so how do you heal it, right? Stop screwing. People ask me sometimes, Doc, how do I make my immune system better? I tell them, stop screwing it up. It's the same way here. Do non-starchy vegetables, some fruit, meat, poultry, fish, range-fed eggs, natural fats, some nuts and seeds. Well, my doctor told me not to eat nuts and seeds. Well, because if you're inflamed, nuts and seeds aren't going to do anything for you. But the oils and what are in the nuts as far as the enzyme processes are good for the body, is good for digestion. When you're healthy, get rid of the carbohydrates, high sugars, grains, sweeteners, bad vegetable oils, legumes. Believe it or not, well, my doctor told me to eat beans. Believe it or not, when you're inflamed, not good. Dairy products. 30% of all people across the board, dairy is inflammatory to them. And ready soda shouldn't even be on the shelf. It just is what it is. And alcohol basically is another issue. So irritable bowel, Crohn's disease, celiac, C1, which is the first vertebrae, and T7 through T11, which is the upper intestinal tract. Okay. So common subluxation patterns in these areas set up for weakness and susceptibility to the symptoms, which ends up being a compounding effect, and it prevents healing and repair. So C1 creates tone and healing. T7 to T11 is the midgut nerve supply. Like I said, the upper intestinal tract. Okay. Acid reflux and heartburn. So when we talk about the stomach, it's basically the sphincters. The sphincters are at the top, which is the hiatal opening, which is right where it says esophagus muscle that closes and prevents acid reflux. That's the hiatal opening. And then the bottom of the stomach, which is where the exit goes out into the intestinal tract. So you never want to have reflux in either direction. Stuff going up the throat into the esophagus burns the esophagus and going down into the small. So these trapdoors, one-way street, as we say, protects the esophagus from the stomach acid. Dysfunction, again, tonal issues, sphincters that don't close, reflux. So then what's the treatment that they teach you? Well, let's give you an antacid. Let's reduce the acid in the stomach so it doesn't come up. There's a whole problem with that because you need the stomach acid. You need the stomach acid to prepare the food to go into the small intestine. And if you reduce the acid, you're sending undigested food into the small intestine. And that creates a whole nother problem. Okay. So acid reflux, heartburn. So T4 to T6. Quick story. As a kid growing up, I used to think all Conley men carried Rolaids. We'd be downstairs getting ready to go somewhere, and my dad would say to me, run upstairs, go get my keys, wallet, cigarettes, and Rolaids. They were always together. My dad carried Rolaids. Well, as a kid, as I started to mature, like around 10, 11, 12 years old, I always noticed that I had indigestion. I just thought it was my mom's cooking. I always carried around Rolaids. And I got to chiropractic school. I'm telling you, carried Rolaids. I needed a new pack of Rolaids. Always had Rolaids in my pocket because my dad did, right? Again, learned behavior, right? And one of the things, when I got to chiro school, I had just finished my NCAA running career. My body fat percentage was like 6%. You could see my bones. Everybody always wanted to adjust me. And the T4, T6 vertebrae, which is what you're looking at in this slide, The adjustment to that area was a straight face down, what they call posterior to anterior adjustment. We would palpate the spine, and whenever any of the clinicians that worked on me, because when you're a student in chiro school, you donate your body to science, okay? You do. And I can tell you that whenever they palpated that area, whenever they touched that area, it was always tender to the touch. So here I am, I start school in August, and by Thanksgiving, I noticed I was carrying around an old pack of Rolaids. The label actually had worn. I had not gone to the Rolaids because I didn't have any indigestion. And as a student, I was getting adjusted probably multiple times per week, which like any chiropractic patient would be. But again, the side effect when I started to understand it was that the thoracic nerves in that area went to my stomach. So lo and behold, one of my first experiences that I talk about with digestive health is the Rolaids story, simply because you don't need them. If your stomach's functioning properly, the subluxation patterns in that area. And it's why often when we do our physical exam with people, we'll palpate down the spine and we come to this little area in the spine where often we feel it as divots, little dents and indentations, because the thoracic vertebrae, because of pressure on the inside of the body, has gone forward. We call it an anterior. And things that can cause this, by the way, ready? Car accidents, sports trauma. And nowadays, what causes it can be the computer slouch, the forward head posture. And it's the number one reason when we start talking about improper breathing, diaphragmatic movement from the sitting position in front of a computer. When we start getting into this, when we say sitting is the new smoking, we know smoking is not healthy for you. How is sitting not healthy for you? Well, this is a big deal. And it's why when seniors are taught to do exercises sitting in a chair, it's the first step in the direction of heading towards the grave, as silly and as dramatic as that sounds. Because when you lose your ability to stand, it creates havoc on your body. So enough said, I just beat that one to death. Enough said, I just beat that one to death, right? So the phone addiction phenomenon, right? It's become pandemic. And we know what the word pandemic means. It's why in March, we did a big production for children in the office to try and get spines checked. We will x-ray any child over 10 years old. And honestly, I'm starting to reshift my thought process to x-raying as young as 7 years old. Because what it does is it allows us to see the spinal problems at an early age. I think every child should have a cervical pillow in the bed, because what it does is it works on the lower nerves of the neck, which are part of digestive health because of where those nerves go. They go to the diaphragm, which is right where the stomach and right where the sphincter is. So it's such a huge issue, okay, where we know it affects it, okay? So it's crazy. There's a slide here where it says, well, if sitting is the new smoking, then screens are the new crack, right? The upper thoracic subluxation and indigestion are the most common symptoms. How do you know if you have a subluxation? You saw these slides now that correlate with major subluxations in these areas. 5 objective criteria: instrumentation, which we just bought new 3 new diagnostic pieces of equipment that we've had since May, June, and we're still trying to implement them. Motion palpation is really the doctor. Motion, we want to see how the body moves. We actually take x-rays that measure the motion. Static palpation is where there's only one doctor in this world that's taught to do what we do. And that's chiropractors. They're taught to check for subluxations of the spine. Visualization, yeah, we can see it. Believe it or not, by the time we see it, it's kind of too late. And then x-ray, which is why we want to get the kids checked. It's just issue, straight up. So 3 steps to correcting these causes: break bad habits. We've already talked about some of them. Add specific exercises, which are depending on the spinal problem, the subluxation pattern. And then what? Chiropractic adjustments. I can tell you, based on personal experience, that digestive issues respond really well to chiropractic. Now, if you're still eating like crap, well, duh. Okay. So when we talked about nutritional recommendations, they're very important. Okay. Very important. There's nothing can be done. It's absolutely not true. Not true. So when we talk about your spine and your nervous system and about your whole family from that standpoint, every one of us has a level of digestive health, which is related to the things that we're talking about. Too many of what we deal with in our life, too many of the things that create these stresses, we can't stop sitting in front of a computer. We can't stop driving a car. From that standpoint, we can start drinking more water. We can start taking more supplementation because our food sources aren't as good as they used to be. We can start doing healthy movements in our body, which stimulate the reduction in the movement of getting rid of wastes in our body. Low back pain, secondary side effect besides pain, is constipation. And when some patients start to get adjusted, they feel like their bowel moved. I have a funny story of a Vietnam vet who came to me. He actually hurt his back because he had a nightmare and it threw him out of bed. So Joe came to me and, I went through the procedure of evaluating him, looking for subluxations in his spine. And we sat him down and we showed him his x-ray and we gave him his first adjustment. I rolled him into his position to deliver a little bit of a force in his low back. And there was this huge pop, of which he let out a blood-curdling scream. This was early on in my career. And I did not give him all the, hey, Joe, you're going to feel a little bit of a crack and a pop in your low back. So it sort of scared him, but he was fine. He started laughing afterwards. He went home that night. And, I saw him the next day for a follow-up treatment. So when I saw him, I'm like, Joe, how did the adjustment go last night? He says, Doc, my back's still killing me, but I got to tell you what happened. I said, okay. He says, I went home last night. And as soon as I got in the door from the chiropractic adjustment, within 15 minutes, I felt this urge, Doc, I had to take a dump. And I said, okay. So what are you telling me? He said, Doc, I went in the bathroom. I had the largest bowel movement I've had in years. And I said, okay, that's a little bit too much information. He said, Doc, I have constipation. I can't move my bowels without any medication. This is just amazing for me. Let's get to work. So the experience that I'm telling you about my good old friend Joe was people that think chiropractic doesn't affect intestinal, digestive habits, bowel habits. You're absolutely wrong. And in this workshop, I've identified nerves. I've explained it to you. I've explained to you that the body's smart. And from the standpoint of this feeling right here that there's nothing can be done is absolutely hogwash. This is how chiropractors get in trouble. We tell you the truth. The reality is we're giving you answers, strategic answers in today's day and age to be healthy. That's what we do. The largest natural drugless profession in the world. It ain't about neck pain and back pain. It's not about headaches. Those are the big three and we're good at it. But when we talk about being healthy, you look at the continuum, figure out where you are. If you're left to center, you're not where you need to be. It's a journey, okay? As with every workshop, we always put up the schedule a consultation. If anybody ever says that they saw my webinar, okay, the last slide right here is our QR code that'll take you right to our scheduling page. I'll leave it up here for about 15, 20 seconds as I close. Look forward to some of these workshops being online, being in our YouTube channel. Subscribe, hit the button, thumbs up, all the things that you do to keep in touch with us as we try to give more and more of these for your viewing. So I appreciate your time and your attention, and I hope I see you in the office. I'm going to pass Kristen the mouse here so she can close it all out. It was good seeing you. Take care.